Okay, starting with point 467. Fetal component of placenta is formed by chorion frondosome. Now we will learn about development of placenta. Placenta develops from the chorion frondosome and decidua bacillus. Fetal placenta or chorion frondosome, which develops from the same blastocyst that forms the fetus itself, and the maternal part of the placenta decidua bacillus, which develops from the maternal uterine tissue. Clear? Now we will learn about the fetal component and maternal component of placenta. Clear? Fetal component comprises of two parts, cytotrophoblast and syncytiotrophoblast. Now, cytotrophoblast is the inner layer of the chorionic villi. Cytotrophoblast makes cells. You can learn from the point CC. Clear? Okay, syncytiotrophoblast or the outer layer of the chorionic villi. Syncytiotrophoblast synthesizes and secretes hormones like HCG. Structurally, it is similar to luteinizing hormone. It stimulates corpus luteum to secrete progesterone during the first trimester of pregnancy. Now the maternal component of the human placenta decidua bacillus, and it is derived from the endometrium of the uterus. Let's practice some paper MCQs. The first one is fetal component of placenta is formed by chorion frondosome, while beta HCG produced in the late pregnancy is produced by syncytiotrophoblast and fetal endothelium. Clear? Syncytiotrophoblast and fetoendothelium both secrete human beta HCG in the late pregnancy. Clear? Placenta acts as a barrier. It acts as a barrier and it prevents mixing of maternal and fetal blood. Okay. Placenta in normal state does which of the following? It prevents mixing of maternal and fetal blood. What is the fetal component of placenta, which is providing most of the nutrition and gaseous exchange? It is the cytotrophoblast of the placenta, which is providing most of the nutrition and gaseous exchange possible for the developing fetus. The next is during last trimester, separation of mother and fetus. How does it help the fetal endothelium and the syncytiotrophoblast? Clear? During regarding human placenta, it separates from the uterine wall due to rupture of uterine muscles. Clear? At 20-week, placenta act as a strict barrier, syncytiotrophoblast, connective tissues, endothelium of the fetal tissue. Clear? Now we will see the next point, which is 468. A pregnant lady presented with lower abdominal pain on ultrasound, placenta is attached to the myometrium but does not penetrate through it. It is placenta accreta. Clear? Now we will learn about on the basis of location of placenta, we have divided into four types. Clear? The first one we are going to learn is placenta previa. Clear? It is a condition when the placenta attaches to the lower part of the uterus covering the internal os. Clear? Placenta previa, it means that the placenta is attached to the lower part of the uterus and it is even covering the lower part of the cervical os. It is the classic cause of third trimester bleeding. Okay, if the patient is having placenta previa, the patient will present with third trimester bleeding. Ectopic pregnancy is the classic cause of bleeding in the first trimester. Clear? Now, if we learn this, that what is the classic cause of bleeding in the first trimester, it is going to be the ectopic pregnancy. Patients with ectopic pregnancy will present to us with bleeding in the first trimester, while those having placenta previa, the classic cause is third trimester bleeding. Clear? Now, placenta accreta. When is when the placenta gets implanted in the myometrium, superficial aspect of the myometrium, but without deep invasion. Placenta accreta means that the placental vessels have invaded the myometrium, not very deep invasion, but somehow it has penetrated or implanted itself in the myometrium. Clear? The next is placenta increta, in which placenta goes and gets impacted into the myometrium. Clear? Now it has a deep invasion. Clear? Placenta percreta is when the placenta gets implanted through the wall of the uterus. It is placenta percreta. Now let's practice some paper MCQs. Placenta attaches but does not invade the myometrium. It is placenta accreta. When it does not invade deep into the myometrium, it is placenta accreta. Whereas if the placenta gets implanted deep into the myometrium, it is called placenta increta. Glucose transport through the placenta is through the facilitated diffusion. Clear? You should know कि ग्लूकोज की जो ट्रांसपोर्ट प्लेसेंटा से हो रही है, it is due to facilitated diffusion. About human placenta gets separated when there is rupture in uterine muscles. Clear? Now we will learn the next point, which is 469. Sinus venosum develops into coronary sinus. Clear? Embryological points per day. So the last point which we have to learn is 469. Sinus venosum eventually develops into coronary sinus. Now let's do some derivatives, postnatal derivatives. Clear? अब देखिएगा, सबसे पहले हमारे पास है एलेंटॉइस और यूरेकस. ठीक है, मीडियन एम्ब्लाइकल लिगामेंट. यूरेकस इज अ पार्ट ऑफ एलेंटॉइस डक्ट बिटवीन द ब्लैडर and the umbilicus in the embryological life, which is converted into median umbilical ligament. Clear? तो आपने n से याद रखना है कि it is median umbilical ligament. The next is ductus venosus. ठीक है, ductus arteriosus. ductus arteriosus further क्या derive हो रहा है, ligamentum arteriosum. ductus venosus, ligamentum venosum. Left horn of sinus venosus forms coronary sinus. Foramen ovale forms fossa ovalis. Notochord forms nucleus pulposus. Clear? Umbilical arteries form medial umbilical ligaments. Clear? अब हमने ये चीज़ें याद रखनी है कि यहाँ पे मीडियन अम्बलाइकल लिगामेंट था, जबकि अम्बलाइकल आर्टरीज से मीडियल अम्बलाइकल लिगामेंट्स हैं. द नेक्स्ट एंड वेरी लास्ट इज umbilical vein. It forms ligamentum teres hepatis, round ligament. Clear? And it contained in falciparum ligament. Clear? Yeah, that was the end of your embryological section of Raffi Ullah.